Thank you.
Mr. President, thank you for your bold leadership that's allowed our teams to go far beyond what anyone thought was possible. On behalf of the Domestic Policy Council and Vince Haley here, we would like to also thank all the agency partners and the stakeholders that we worked with to get to the solution today that will make a real impact for families. Specifically, today's historic actions, 4 in total that you see, are made possible by coordination of all of the White House team and 7 agencies, many of who are represented here, and their teams that have worked tirelessly. As you described, Mr. President, the current system isn't working. 7 in 10 Americans don't have coverage to IVF. They face high costs and uncertain outcomes. And there's intense demand for fertility benefits. 65% of Americans say that they would leave their current job just because of fertility benefits. So you asked us to lower costs and to fix the broken incentives in healthcare. In addition to lowering the cost of drugs by 73% or $2,200 per cycle, which if you missed it, most people require 2 or 3 cycles. So it's significant savings for families. I'm also going to briefly outline the new solution for coverage. This is a new fertility benefit option that employers can immediately offer to their employees starting today. This afternoon, the Departments of Labor, Health and Human Services, and Treasury will be releasing guidance that, for the first time, creates a legal pathway for employers to offer fertility benefit packages to people that need them, similar to how dental, vision, and life insurance are currently offered. This will be followed up by a regulation. These benefits can address the continuum of fertility needs, from the root causes of IVF, which Secretary Kennedy is working on very hard at HHS, to it'll be a coordinated package that does not exist in traditional health insurance today. It'll make it easier for employers, including small and mid-sized employers, to compete for talented employees. Currently, many small businesses cannot afford to offer fertility benefits at all. This is making it possible for them to offer benefits the same way that large companies like Amazon and others offer benefits. This is a pro-family benefit expansion that will transform clinical outcomes by addressing fragmented coverage and care. I'm a physician by training, and it's very important that we have high-quality care. Fertility benefit companies are poised to offer packages that have reported so far roughly 25% higher live birth rates for those that seek care compared to those that don't have such benefits. They also report fewer cycles to achieve pregnancy, improved natural pregnancy rates through better care before you need IVF, and reduced chance of miscarriages, a 21% reduction in miscarriage rate. Leading physicians in the field have also relayed that these types of benefits significantly improve the patient and doctor experience, allowing both to focus on care rather than navigating the bureaucracy. These impacts are very personal. Here with us today are my good friends, Congressman Richard Hudson of North Carolina and his wife, Renee Hudson. Both have worked in public service for years, including Renee for all 4 years of your past administration, Mr. President, and they struggled with infertility. Today they have a beautiful son who's their pride and joy. He's an amazing boy. But they also suffered multiple losses throughout their fertility journey, something that is very common. Unfortunately, too many people go through the hard, arduous process of IVF and still result in a miscarriage. So today, your option is not only saving money, it's going to improve the quality of care significantly. This new benefit option simultaneously represents the greatest opportunity to expand coverage of IVF that the federal government has ever taken, while also improving the care delivered. Additionally, and very importantly, it gives employers maximum flexibility to design benefits that are consistent with their values. Put simply, this new fertility benefit option means lower costs and more healthy babies. So today, this announcement, we are realigning the industry towards the simple metric of more healthy babies at lower costs. I would now like to introduce Samantha Bush, the wife of NASCAR driver Kyle Busch, who's been a leading advocate for IVF access and affordability after your own infertility journey. Thank you, Mr. President.